It's up. Doctors are bracing for an uptick in injuries. It's a trend doctors typically see every year, and some even call it the summer of trauma season. Dr. Christopher Manock is here with us now from Michigan Orthopedic Surgeons with how you and your family can stay safe this summer. Good morning.
Morning. Thanks for having me.
Of course. Thanks for being here. So can you tell us what are some of the common injuries that you see in the summer?
So as you mentioned, we definitely see an increase in injuries in the summer months, and we typically see injuries either to the foot, ankle, or lower extremity from a twist and fall type injury, or to the upper extremity, the wrist or elbow area from a fall, typically where you put your hand behind you.
Now, some kids may be too young to communicate how much pain they're in. On the flip side, other kids might exaggerate how much pain that they're in. What's a good sign to look out for if you see an injury that maybe could be serious?
Yeah, it certainly is difficult for younger patients to discuss or even articulate where their injury is and what they're feeling, but things parents can look for are if there's swelling, especially swelling that's getting worse over a day or two, especially if there's bruising or if the child's unwilling to use or put weight on an injured leg. That's something that could indicate a fracture, a more serious injury than just a sprain or a strain.
Now, you specialize in pediatrics. What are the advantages of going to a pediatric physician?
So pediatric orthopedic surgeons train specifically to deal with children and teenagers who are different than adults in the sense that they're growing. And with the bones growing, there are growth plates, and oftentimes injuries can go into these growth plates and may require a little bit different treatment in order to heal properly and get the children back to running, playing, and any sports that they do.
And why are those growth plates so important, and it's so important for doctors to take those into account?
The growth plate is an area at the ends of bones that's actually a little bit weaker than the bone and some of the ligaments around it. So a lot of times fractures or injuries can go into the growth plate. If it doesn't heal properly, if it heals too shifted, sometimes growth can stop on part of or the entire growth plate, leading to growth stopping or growing at an angle for that limb.
And I understand your office has something called urgent ortho. What is urgent ortho, and what are some of the benefits of using that maybe instead of an emergency room?
Yeah, we do have an urgent care that's staffed entirely by orthopedic surgeons or orthopedic PAs who have experience in these musculoskeletal or injuries to the extremities. It's a little different than the ER, where you're seeing an ER physician that's skilled in a variety of different disciplines and emergencies. An advantage of going to the urgent care is it's usually a little bit of a shorter wait, and you can get evaluated by somebody who directly deals with these types of injuries every day.
And it's my understanding you now offer waterproof casting?
We do offer waterproof casting in the summer for most injuries. That's something that patients can get fully wet in a shower or in a bath or in a lake. And it makes it a little bit easier to be in a cast while their injury heals in the summer.
Can they go swimming, use the pool?
Yeah, they can go swimming. Yeah, they
Perfect.
get fully wet, so it makes it easier for the parents.
So where can people go to learn more about Michigan Orthopedic Surgeons, make an appointment?
You can go to miorthosurgeons.com to see our locations and to book an appointment.
Awesome. Doctor, thanks for being here with us. We appreciate the tips.
Thank you for having me.
And I'm sure someone who appreciates the tips is Kevin Jeans. We do not want Kevin Jeans hurt because we need to turn to him for the weather.